About 50 million people are affected by this condition globally. The risk of premature death, 3 times greater than normal population. 1,500 people in Canada alone, and if not treated properly, 70% of these people will have a high risk of death. Every year, 600 people die. Sudden, unexpected death in epilepsy. Sudep for short, is a condition in which frequent epileptic seizures occur and there's no way to resolve what actually causes them. Research is still underfunded, but many experts say that it may be causes of seizures which would cause heart palpitations to miss a beat or rhythm. So we may ask, what is epilepsy? Epilepsy is a condition in which there's a traumatic seizures or recurrence of seizures in the brain. These seizures are nothing but electrical stimulations going haywire in the brain and causing a thunderstorm. Usually this thunderstorm causes brief periods or long periods of fits. Fits is another word which is used to explain a huge physical shaking and uncontrollable vibration in the body that could cause potential damage. In terms of damage, you may ask, there could be physical damage, it could be unawareness of the sensations, or even lack of awareness altogether. Consciousness could be lost. There are 2 types of seizures. There is a generalized seizure that affects both sides of the brain and has quite an intense appeal to it. And then the focal seizure, which affects just one part of the hemisphere and is not that intense. There are many things that trigger seizures, such as flickering of lights, having no meals, lack of sleep, or even humidity for that reason. But it's quite important to make sure that epilepsy and seizures are identified and diagnosed. Some of the main diagnostic tools that are present in this current world include blood tests, EEGs, CT scans, and even MRIs. Treatment for MRIs varies by severity and condition of the individual. You could have anywhere from anti-seizure drugs or vagal stimulants or even a brain surgery. Recent studies have found that 80% of the individuals who have had brain surgery in the 6 months after have had no seizures. Another study, 10 years later, has found that there is no seizures even after 10 years. This is quite promising. So you might be wondering, why are people not taking treatment or identifying epilepsy? That brings us to the next point. Societal stigma. Around the world, UK, India, China, have a stigma surrounding epilepsy and seizures, stating that it's almost justifiable for it to be a cause to not get married. In parts of the world such as Africa, Uganda and Tanzania believe that epilepsy is a possession by spirits, by witch, and it is contagious, which is highly it is not. Epilepsy is just another condition, but these societal stigmas influence each and every person socially, culturally, and economically such that they no longer are able to even accept or confess that they have seizures. What can you do knowing now what the issue is? First, promote awareness. Talk with your family, talk with your friends, and ensure that the stigma is broken down. By exploring their hidden anxiety about stigma and seizures, you may be the key factor in bringing out someone who may be a potential epileptic patient and possibly saving their lives.